Hello and welcome. I'm your host, Neil Howard. Thank you for returning once again for another segment of Health Professional Radio. In this segment, we're going to be speaking with Nick Nieslanik. He's joining us here as Chief Technology Officer at Cleerly. Cleerly is a company that's creating a new standard of care for heart disease. He's going to talk about Cleerly Proxy. Welcome to Health Professional Radio, Nick Nieslanik. Thank you for joining us.
Thank you for having me. Thank you.
Can you tell us a bit about your background? Let us in on who Nick is and what brought you to Cleerly.
Yeah, sure. I'm, as you said, my name is Nick Nieslanik, and I'm the CTO here. I've been in technology as an engineer for over 20 years. I spent the first half of my career at Microsoft, jumping through a number of different organizations, got an opportunity to work on all sorts of different things. I then transitioned into digital health, and I've spent the past 9 years working in digital health. I started in digital health in the behavioral health space and chronic condition management with myStrength, and then I was acquired by Livongo. Later, we merged with Teladoc, and ultimately that was the path I took through digital health before making the jump over to Cleerly. But why did I join Cleerly? Well, I'd say I'm just really excited about the mission to prevent heart attacks. I'm working really hard to shift the paradigm of care towards AI-powered care pathways that enable providers to find the actual disease, which isn't something we've been able to do in the past.
Now, I mentioned that we were going to talk about your new workflow solution, Cleerly Proxy. How did this come about, and what exactly is its purpose? How does it work?
Yeah, that's a good question. Proxies are our solution to that gap between the existing healthcare ecosystem of technology and then cloud-based services that are out there like ourselves. One of the biggest challenges is getting embedded directly into that health system or into the hospital or into the provider, and then making it super simple for them to transmit the data necessary to us as well as receive back reporting from us so that we can wipe that away from their worry list, and they can focus on the actual thing that matters, which is providing the best care possible to patients. And so I look at Cleerly Proxy as that bridge.
What you're describing is that back and forth of information. Is Cleerly Proxy sifting through information and kind of discarding things that really don't matter in the treatment plan?
I would say that Cleerly Proxy is a turnkey solution that can be dropped into the site at a health system or hosted in the cloud by us and then connected via networking that allows them to have an endpoint where they can send their data within their existing surface area. So not so much an exploration service as an endpoint that's easy to use, easy to install, completely tailored to their environment, and highly secure, that allows them to, within their existing tool set, pick it as a destination as well as receive information back from it. There's a lot of different players in that market. Generally, they're middlemen that are building marketplaces, and they're complicated large installations. And we've taken a different approach. Our goal is to build something that's personalized to the environment and install that however it fits into the workflow for the physician or the health system.
What was the main challenge that you kept hearing from physicians and payers? What was the biggest hurdle that prompted the development of Cleerly Proxy?
That's also a great question. There have been a few, but one of the biggest ones is security and complexity in installation. Everybody wants to make sure patient privacy and patient data is highly secure end-to-end. Jumping through the IT governance and security certification hoops is difficult and takes time. We want to make that as easy as possible. So we built a playbook for that. We took all the feedback from the different health systems, and then we built a standards-based secure solution that can answer all of their questions right out of the gate. It puts all that worry to bed in my mind. From a workflow perspective, one of the things we hear from physicians all the time is we don't want to log into another system. We don't want to have to learn a new tool. We want to just use the existing PACS, EHR, imaging modality that we already have. And so Proxy enables that. We use standards-based communication. We show up in those existing tools, and they can route the information to us, and then we can route it right back to those existing tools.
Just how secure a solution is Proxy? You said the main thing was the security. What types of measures, unique measures, does Proxy take that haven't been explored before?
Well, I would say that one of the important parts in the healthcare IT ecosystem is not maybe doing things that haven't been explored before, but doing things that are very well trusted. And in this case, we're leaning on existing IT known standards, hardened images, hardened software, hardened communication protocols, end-to-end encryption. So we're taking the best practices across all of the different IT worlds rather than just healthcare, and we're making sure that we're highly secure and at the highest level. And then we can prove it with documentation and certification.
And as far as any updates?
Yeah, we'll always be evaluating new security standards as they come out, and we'll be pushing updates to the Proxy device as necessary, and we'll be monitoring that in real time. If there's a new security threat that enters the market, we'll be highly reactive to it, and we'll be providing solutions in as fast as possible. And we'll keep Proxy up to date and release updates to it with a regular cadence from now on.
What do you see as far as the future for Proxy?
I think Proxy becomes the gateway for Cleerly to embed themselves further and further into those healthcare ecosystems so that we can provide that new standard of care. We want to provide the personalized evaluation and treatment of heart disease for patients. And to do that, we need to have that footprint that lets us connect to the software systems on site at health systems and with providers. So I see Proxy becoming that gateway and becoming a huge part of our platform over time.
Are there any plans in the works for tackling challenges in other disease treatments other than heart disease?
First of all, it's a great question. Right now, we're continuing to focus on extending our commercial reach. We want to broaden patient and physician access to our care pathway and focus on heart disease across its presentation spectrum, including ongoing treatments and early disease diagnosis and finding more effective treatments for those with elevated risk or symptoms. I think there's enough there for us that branching out to other disease states right now isn't the first thing that we're going to look at.
Well, is there anything that you'd like to add? And then give us a website where we can learn more about Cleerly.
Yeah, well, I've had a great time with you today. I'm extremely excited for the future of Cleerly, and I encourage everybody to check out Cleerly's website, www.cleerlyhealth.com.
It's been a pleasure speaking with you. Thank you so much. Hopefully you'll return and we can speak some more.
Yeah, my pleasure. I hope you have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Nick Nieslanik. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.